Welcome back to Business Matters. I am here with Dr. Gert Walter, an Emerson emergency doctor, and we're going to talk about his company, Medical Aesthetics of New England. How are you? Welcome to the show. Welcome
Thank you
back.
very much, George. How are you?
Good. So what are you known for? What are some of the procedures that you're known for?
We've been in the spa now for about 11 years, a little bit over 11 years, and we have a second office out in the Leominster-Fitchburg line. We're one of the biggest Botox and filler providers in New England, and we must do over 20 different procedures. We do some newer ones like PRP and bioidentical hormones. We do some more traditional ones like Botox and fillers, and then I do some surgery in the office also.
And what type of clients do you have? Do you have men and women, mostly women? I know.
Majority women, but we're getting more men. I think men are accepting the different Botox and filler procedures more often.
You know, we were talking earlier, I've been doing it for 7 years, so I find this, very fascinating. So what is your specialty? Like, would you say your specialty is? Is it everything you just listed is?
I mean, yeah, I'm actually an emergency physician, so that medical
saving
emergency
people's
specialty.
lives is your specialty.
So
which
this is my other specialty here. I think it's making people happy and giving them what they want in a safe way, in a professional way, and also I think the office is very relaxing. People come in there and it's really, we try to have it be sort of a spa-like setting rather than a physician's office.
And you're a doctor. What made you decide to get into having a spa to help
I
people
blame
look
my
younger?
partner. My partner is Stephanie Liatza. She's a nurse, and we're 50-50 partners in the business. And she was an emergency nurse, and she started getting into this and needed a medical director. And then I started looking into it, and eventually we came together and supported by our spouses and started this. It's been over 12 years that we started looking into it, but officially open a little bit over 11 years.
Now, you're a doctor, so of course you had extensive training for the emergency department. What kind of training did you have to go through, educate yourself about just fillers and, injection sites and...
Yeah, when I went through my residency, I won't say how many decades ago it was, but Botox and fillers they just weren't around. They didn't exist then. So, and I think other physicians that are my age also have had to learn their specialty training for it, and we try to keep up. Several times a year we go try to stay up with the newest, and the Botox company Allergan is very good about for certain select providers to give us sort of they call them master's courses and just go and get kind of the fine nuances and how just how facial aesthetics has changed over the last 10 years. When we first started, the classic was sort of if you see a line, you fill it in, and then it's become much more realizing that why those lines are created. It's not from smiling too much, but it's really from loss of tissue in the middle of the face, whether it's fat and bone and muscle, and then sort of recreating that and just giving people a much more natural look than even 10 years ago, even 5 years ago.
And a natural look is important because I'm sure you've seen in your practice, people come in and they've had a bad procedure, maybe they
Or look on TV.
Right, Nicole Kidman.
Yeah.
She's a little bit overdone. I mean, what would you advise people if they want, too much or too little?
I think New England's a little bit conservative compared to some, California and some of the other parts of the country, and I think that's where our aesthetic is that people typically they often say that they want to look better but not have it be obvious, and sometimes if you have a facelift, it can completely changes how you look. And I think with the Botox and fillers, it's more subtle, and just kind of give them a look of what they looked like 5 or 10 years before. I mean, we can really completely change people, but that's not typically what people are looking for.
Now, what advice would you give people who are contemplating, plastic surgery versus fillers and Botox?
There's some plastic surgery. I'm not a plastic surgeon, so I don't do the surgery in the office or in the hospital. And there are plastic surgeons who do fillers and Botox too. So I think it's just talk to as many people as you can, and I think that the job of the physician or the nurse or the practitioner is to try to, if people would, people would come in and they would say what they're looking for, and then our job is to sort of say, well, maybe that's too much, or maybe have you thought of this, or let's do it the way you said. Some people come in and they want their forehead taken care of, they want their nose, they want their lips taken care of, and we may see something different. There's some doctors who will say, oh, you need to have your breast lifted and your face done and this and that. We're much more about talking to the patient and really kind of trying to figure out what they're looking for and help them along that path.
Because I think it's really important to be honest with people. If you're just trying to sell them something they don't need, it's better for the patient, it's better for the person, how they look in the end.
Yeah, I agree.
So There's a bioidentical hormones. What is that? I've never heard of that.
So bioidentical hormones are basically hormones you already have in your body. And as we get older, women hit menopause, their estrogen goes down to almost nothing. Men, testosterone goes down more gradually. Women, testosterone. We look at progesterone, we look at thyroid hormones. And bioidentical hormones, if you looked at the molecule, it's what you have in your body and just maybe not enough of. So we try to optimize the hormones. That's different than the synthetic hormones, the Premarins and the Prempros and the bodybuilders.
I know nothing about hormones, so this is very, I know someone who's transgender who's on hormones, but that's for a different reason.
Transgender is really kind of a specialty because it's not just the hormones. There's there's surgery involved and sometimes social issues also, and so it's really a little bit more specialized than what we do. But what we do is men who have low testosterone, anybody who has low thyroid, women who have either before menopause or having symptoms, because sometimes the symptoms start 5, 10, 15 years before, but it's really kind of replacing what you had before. And it's really a very rapidly growing part of our business. And I think it's because people they get so transformed. They feel like they did before. And it's all the time people are saying, this is just life changing. Why do you have to have lousy sleep and a low libido and it hurts and you just don't have the energy and the brain fog? You didn't have that 10 years ago, and we can replace that.
I think as we get older too, it's all about maintenance. There's nothing wrong with a little maintenance, and I think what you do is maintenance. Yeah. Maintenance for yourself. Yeah. You do maintenance on your car.
We're not trying to turn people into Arnold Schwarzenegger, right? It's just getting back what you had before. And we're part of BioT. BioT is the largest hormone provider in the country, and there's about 2,000 different practitioners, nurses, and physicians that do this with over 20,000 treatments a month. So it's huge. It's just we're the closest one to us is in Hartford, and then there's only 3 in New England, and in Dallas there may be 20 of them. So it's just really slow coming up to New England. We're trying to change that.
And then would someone get a blood test prior with their physician and see if they have low T or where their hormones are?
And we do blood testing and symptoms too, because sometimes the tests don't quite match up to the symptoms. The blood tests are kind of a guide. So we check it before and after. We don't check it every time you come in, blood test you to death, and we're not vampires. So if everybody's stable, we may check it again every 6 or 12 months or something.
And what does this, how long is the treatment? How many weeks does it take to do? If I had
the treatment takes 10 minutes.
10 minutes,
Yeah.
and that's
It's
just
blood
one
testing
time and done, or
beforehand.
do you come back?
No, for men it's about every 5 to 6 months, so it's
Okay.
twice a year. Women it's 3 or 4 times a year.
Oh, that's wonderful.
Yeah.
Tell us about your staff and the people who are trained working under you. How many employees do you have?
So we have, my partner's a nurse, we have another nurse, and then we have 2, we have a secretary, Jasmine's, she's a business manager.
There's many things you can do if you don't want to get Botox or fillers. You can come in and I'm sure you do microdermabrasion and things like
chemical
that.
peels, yep.
And so what are some of the benefits for that? Because a lot of people have sun damage. I don't know if anyone knows. You should always wear sunscreen. The first thing you should do when you get out of the shower is put sunscreen on your face. I'm in my 50s. I've been putting sunscreen on my face since I was 25. I tell everybody that is like the slow fountain of youth.
It is.
I recommend that.
And unfortunately, most of us did baby oil, and some people did the
we all did the
surgery.
baby oil and iodine back in the 80s.
Yeah.
We didn't know any better, but now we do. The sun causes extensive damage. What type of things can you do to help alleviate some of the sunspots?
And some of it's natural aging and cigarette smoking and air pollution. There's a lot of different things. Some is genetics. Microdermabrasion, chemical peels, they can help with it's really more gentle treatment, and then we have some lasers that go deeper and can help with the wrinkles and the brown spots and then the veins and just sort of the unevenness of the color of the skin and texture of the skin.
Now, you mentioned another PRP procedure that you do.
PRP is something that we have been doing for a couple of years now. PRP stands for platelet-rich plasma, and essentially what we do is we draw your blood. There's a special way we process it to really concentrate the platelets, and then inject it back into you. So number one, you can't get allergic to it because it's your blood. You're not getting something from somebody else. And the analogy I use is if you cut your skin and do nothing to it, you're going to bleed, and then the bleeding is going to slow down and stop, and then it's going to get a scab over it, and then the scab falls off, and you got a pink scar, and then the pink scar heals. Platelets are a very important part of all that entire healing process. It stops the bleeding, and then they actually have growth factors. You have growth factors in your platelets. It draws in your own stem cells. into that area to help with the healing. Because if you cut yourself, you're cutting blood vessels. This gets a blood vessel to regenerate and grow again. It gets the collagen to rebuild. And we use it in a lot of different places. We do something called an O shot and a P shot. We're actually taking your PRP and injecting it either into the penis or into the vaginal area to help with libido and help with sensation. That's one procedure we do. We can inject into joints. It's actually been done for about 20 years by the orthopedic doctors. And then we a lot of times we'll do it on the face and then putting on the skin and putting it underneath the skin, or sometimes we'll inject it like for hair. We can
so
do that.
you get several benefits from this
Yeah.
procedure. Now you also we talked earlier. You do liposuction now. Before it used to be, there's different methods of liposuction.
Sure.
I think that has evolved too. I think in the last 20 years, it was when they first started doing it. It's much different now. So how do you do it?
So traditional liposuction is just basically numbing people up or putting them under general anesthesia and going in and doing suction, and sometimes can produce very nice results if the hands are skilled. What I do is I add also an ultrasound and a laser, and the ultrasound helps to melt the fat, so it's a bit more of a gentle procedure, and the laser helps to tighten up the collagen again from underneath, to get some extra contraction of the skin. Just because sometimes if you take a lot of fat out, then people have saggy skin afterwards. This won't take care of if they've had bariatric surgery and lost several hundred pounds. But if it's, if it's just somebody who's trying to get a little bit from here or there, then that it's really a nice procedure. And you can look on our website and see the before and after.
Now, the fat cells that are extracted, if you do gain weight, what happens? Do they go back in that place? I mean, I've heard stories where it might be distributed at another place in your body.
No, it's actually kind of
that's a myth.
That's a myth, yeah. The fat cells that are taken out, that are destroyed, are gone. So if somebody gains 50 pounds, what's going to happen is they're going to gain less in the area that the belly or thighs or whatever. They're going to gain less fat there because they have fewer fat cells, or they're going to have less size change. But their breasts may get bigger and other areas may get bigger because that hasn't been touched, and so they're going to put the weight on there. Yeah, so the fat doesn't like move around and go to a different place.
No, it's excellent. Like I said, I'm going to say to people home, if you're interested in this stuff, and maybe you're intimidated, what would you like to say to someone who's never had anything done, who's thinking about, maybe I could who doesn't want to look 10 years younger? What would you like to say to those people?
Well, we don't charge for consults, so come in and talk to us.
So a free consultation, that is excellent.
You can talk to the physician, me, you can talk to the nurse, you can talk to the laser techs. The other thing is we use numbing medicine. We have lots of different ways. We use ice. We have different ways of trying to make it more comfortable for people, because sometimes shots do hurt. Not all the time. There's some techniques we do that make the shots not hurt so much, but it depends on what the procedure is. So with a numbing cream, we have a machine that blows cold air on people. We sometimes will put numbing injections in depending on what the procedure is. So all of that to try to make it as comfortable for people as possible.
Excellent. Well, we only have like 30 seconds left. If people want more information and they want a full list of services, where can they find that?
You can go on our website. The business name is Medical Aesthetics of New England, and the website is www.medicalaesthetics, AESTHE. We'll put the logo, the name down there, nefornewengland.com. And that has all the before and afters. It has testimonials, how to contact us, you can set up a consultation right up online. And of course you can call us. And the phone number is 978-263-1406.
I had the chance to stop by Medical Aesthetics of New England to see Dr. Walter for a facial evaluation and how Botox could help alleviate some of my frown lines.
Tell us what you think that I need.
Well, one of the things that when people come in is we do like a full facial evaluation. And a lot of people come in and they've heard on TV about the frown lines and they've heard about crow's feet, but there's lots of other places we can do Botox. Those are just the most common. So it's really whatever the patient needs. And looking at George here, what is it that bothers you?
Well, I've been getting Botox for a while. I used to have really deep lines, and since I've been doing it, they're not as bad, but yeah. When I go like this.
Okay, so the forehead here. And these are actually separate muscles. So these are called the 11s on TV. The glabella muscle and the corrugators, they kind of come in and they do this and they push this down. So that's what causes the wrinkles there, and also that one right in here.
Right.
Totally different muscle for the forehead, even though it's on the face. So look surprised, and you can see how it lifts up. So this muscle actually goes way around on the outside here. And we can certainly treat those both together. So that's what we'll treat today. So his forehead, his wrinkles, these are the ones that are most prominent there to there, but see the wrinkles out in here? So he's got a strong muscle that pulls up in here, and if this is all relaxed, that's what's going to create the Spock look of this bit of the muscle in the corner right here pulling up like that. So that's why it's important to treat that too.
So he's going to get the ice and the Botox, and we're going to show you the procedure. So stay tuned for that.
All right, George, you ready?
I'm ready.
Okay, I'm going to start first with your forehead.
Here.
So the other thing that's important is when Botox is taught, very often it's taught very formulaic. So it's 6 units, 4 units, 3 units, and when people don't have a lot of experience, that's what they do. You really want to have somebody who's talking to you all the time, a practice, somebody who's going to do the injection, and watch your face all the time, because what we're constantly doing is watching what the movements are, what the natural movements are. If if a woman has bangs down to here and she has wrinkles in the forehead, she may not need to have that treated if she never sees it, or if they always wear big glasses, maybe they don't have to have this area treated in here. So it's very, very individual. I think that's the important thing for people who do this, who are experienced, that you always want to be talking, having somebody, that's what we're doing. I'm trying to constantly chat with you and having you move your face to see how the muscles act.
Okay.
All right?
Great.
So first thing I'm going to do is do across the forehead. And I'm going to start way out in here and just wrinkle your forehead up again. Okay, good. And you can relax there. It's kind of hard to keep holding it up like this, so I'm just putting my fingers there as a marker. The other thing we don't want to do is put the forehead Botox too low down in here, because that's going to do this. So we'll kind of keep the forehead muscle goes way up in there.
It's a science.
And an art.
It's an art, yes. And
You
you're
ready?
an artiste.
All right, and then okay, here we go. So here comes the first shot. All right. Let me grab a mirror for you.
That was painless.
Couple little twitches there, but
Good.
our mirror walked again.
It didn't hurt at all. It just felt like a little spider bite or whatever.
Here it is.
And this is all going to settle in about a week to 2, or can't even tell.
Yeah, no bleeding, no bump. So again, we make ours pretty concentrated, and that's why it's you don't walk out with looking like you've been attacked by mosquitoes.
Yeah, no, it's
But
great.
even if you did, it would go away in 20 minutes or something
So
like
I
that.
should see results within a week, you're thinking?
You may start seeing in 1 to 3 days, you may start seeing some change in there, and then in a week will be most of the change, but 2 weeks should be the full change.
And if you want to, just a consultation, maybe you're curious about getting some work done. I mean, we all want to look our best. Come down and talk to Dr. Gert Walter.